Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff, and this is our daily update on the COVID-19 situation in our community. The latest numbers tonight, 665 cases of COVID-19 in our community, up from 615 yesterday. We have 151 travel-related cases and 210 community transmission cases, with the largest number of cases, 243, coming as a result of close contact with another person who is positive for COVID-19. 61 cases are under investigation. That's a significant number. Those are the cases in which the contact tracing investigation is not yet complete. It shows you the volume of work that's happening on each and every positive infection in the investigations into who has been exposed to that particular person. Painstaking work, but we thank all the public health professionals that are leaning in to make sure that we're doing proper contact tracing in San Antonio. The number of people who have recovered from the virus in our city remains at 92 tonight. Of the 665 cases, 89 are currently hospitalized. 56 patients are in intensive care tonight and 44 are on ventilators. The stress on resources at local hospitals also remains manageable. We have over 2,000 beds available, which is 42% of all staffed hospital beds in Bexar County. And this is a result of hospitals, as we said, canceling all unnecessary procedures. We also have roughly 541 ventilators available right now, and that's 77% of the ventilators available in Bexar County hospitals. We're closely watching also the nursing home situation, and unfortunately 2 more residents of the Southeast Nursing and Rehabilitation Center died today, and that brings the deaths from that facility to 12. Overall, 24 local residents have died from COVID-19 in San Antonio. Aside from Southeast, there are no other localized outbreaks at nursing homes in Bexar County, and we're grateful for that. Judge?
Thank you. Thank you very much, Mayor. Well, we had our first inmate in the Bexar County Jail test positive yesterday. He had spent time in 2 different pods, 64 allowed in each pod. There were about 116 people, other inmates, that he came in contact with during this period of time. Now, we've put him in an isolation cell. What we're doing now is that the most vulnerable ones in there, if they show any sign or any evidence of possible COVID-19, we're separating them out into smaller groups. We are taking their temperatures twice each day to make sure that we're not going to develop another case, and we're requiring all of them to wear masks. And we will do that for the next 14 days. Now, we do have a vulnerable population there, not totally unlike what's happening in nursing homes. 80% of them either have a drug problem, mental health problem, or both, and many of them do not take care of themselves very well. Now, that's a threat to each other, but it's also a threat to our jail guards, and it's a threat to the community if a jail guard comes out and has it from an inmate. So all these steps that we're taking now to do our best to contain it, we will be working very hard on that. It's a major problem in a jail because we have 22 pods with either 64 or 84 in it. It's not so easy just to put them in a simple cell, because then they have a right to come out at least 1 hour a day. I mentioned, I guess 2 or 3 weeks ago, beware of false tests that are put out in the community that are not been approved by FDA. We had an Austin firm trying to do that, selling them to Hays County. Just happened here just recently. City of Laredo bought 20,000 tests from a manufacturer. Homeland Security came to Laredo, confiscated all 20,000 of those tests because they were not certified and were done by a manufacturer that has not met the standards that need to be met. So just continue to be aware of that, and let's make sure you don't take a test that's not authorized and then you get a false sense of being okay.
Thank you, Judge. And we know that this is a very difficult time. There's a lot of stress, particularly on children. So I do want to let all the parents and children watching tonight to know that we'll be hosting a COVID-19 Children's Town Hall on TVSA and the city's Facebook page, and that's Monday at noon. You can go to the city's Facebook page and submit a question either by video or in writing, and I hope you will watch on Monday. As always, you can get the latest information on COVID-19 by subscribing to our text program. That's texting COSA.gov to 55000 or by visiting sanantonio.gov/COVID-19. We must all do our part to slow the spread of COVID-19. Stay home when you can, but especially if you're sick. Wash your hands with soap and water. Cover your coughs. Leave some groceries for your neighbors and only buy what you need. We're going to get through this, and we want to wish you a very happy Easter weekend. Now we'll take some questions.
Mayor, Judge, good evening. Earlier today it was announced that East Side River Center and Westover Hills had been chosen as two spots to possibly transport patients who had tested positive for COVID-19 over at the East Side Nursing Home. And these patients, obviously, hopefully not showing any symptoms, would be transported to stay there. Now, Commissioner Calvert had expressed some frustration over to us at KSAT 12, noting that this is a densely populated minority area. What was the process in selecting these two facilities, and what is the city and county's response to the commissioner's frustration?
So as a result of the nursing home situations in both Kirkland and we've seen here in our community, it's very clear that we need to have facilities made available that are isolated from the general public, but also the residents who are well. The largest companies, the largest managers of nursing homes in our facilities selected by themselves facilities that they could potentially use to house COVID positive patients. There's nobody in either one of those facilities. The judge and I believe that the Westover Hills is a better facility and should be the first to be used, but at this point there is nobody in either one of them, and those are only again to be used to isolate COVID positive nursing home residents, a very vulnerable population from anyone else who is well.
The only COVID nursing home patients now, I believe, are over at the Southeast, and they will remain there. They're not going anywhere. We haven't had any in any of the nursing homes. So they did come together to identify two sites. We believe the Westover Hills site is the best, and we're making that known to them because it's a relatively new facility. We hope that we don't have to use either one of the two, but as stated, it makes sense to keep them together, and this is the plan they came up with, and we're pushing them to use just the Westover. The other thing we've clearly said to Strack and the others, we don't want them bringing in patients from outside the San Antonio and Bexar County region, and we are not going to let that happen. So Westover Hills first, and I seriously doubt, considering where we are now, that it'll ever reach the East Side.
To follow up on that point of the commissioner's frustrations, I mean, he said that he was raising hell over this decision. I want to get your two's take on his frustrations and some of the residents there.
Well, I don't blame him for being frustrated. Nobody wants to take care of people like this. Nobody wants them in their neighborhood. But that was not a decision we made. We are weighing in on where we want them to go, and we want them to go to Westover Hills. We think that's the best facility. If you read the press release that was put out, it made it very clear they're ready to accept them there, and they're ready to go.
And the decision was made by these two companies then for these facilities?
Yes.
So with that, if no one from Southeast is moving, when will we hope that we don't use these facilities? What would it look like for us to actually use these facilities?
Again, I think the judge is right. We hope to not have to use those facilities because, again, that would mean that there are no outbreaks in any other nursing home facilities. We've been going in there proactively, particularly in those locations where there was staff shared with Southeast. We think we have that picture clear, that there's no more infections, but in the event something else does happen with one of our residents here in Bexar County, want to make sure they have a place to stay that would be isolated from anyone who's well.
And don't forget, we still have COVID patients in southeast part of town. I'm sure a lot of people don't want them there either. But we're doing it, and we've not had concerns from the southeast raised to us.
During yesterday's daily briefing, Mayor, you had mentioned something about quarantines, hotel quarantines for those that may not have a place to go, given that they may need to quarantine. What is the status of that, and how will those people be transported to that hotel?
Yeah,
Go ahead.
Yeah, there are isolation residences, temporary residents located throughout this city that we've contracted with in the event that someone is positive and wants to get away from their families to keep their families safe. and you can call the hotline. You can call 311 if you need access to that. We'll be able to screen you and make sure you get to the right location. There is going to be transportation available if it's needed, but we do have those isolation facilities available. That's something that had been worked on from the very start of this process.
And Judge, in response to the inmate that had tested positive over at the Bexar County Jail, was that inmate at a high risk?
Well, I know he was designated low risk, and I don't know that that designation was changed, but it was originally designated low risk.
And at this point, you said those inmates at this point are getting their temperatures checked twice a day. Is that correct?
Temperatures twice a day, and there's no simple answer to it at the jail, but we're intensifying our efforts. I believe the effort of we've been requiring new inmates coming in to wear a face mask for some time now. Now we're requiring all of them to wear a face mask, as well as our guards, and that certainly will help it. And then if we do see a person that's vulnerable, gets some sort of symptoms, we'll separate them and get them in a smaller group. But the jail's not a hotel. They even if you have them in a cell, you got to get them out and move them around. So nothing's real easy about it.
Forgive me if I missed this. Why would you select Westover first? Why would that be the first one?
It's a relatively new, well, it is. I don't think there's anybody in it right now. It's a new facility. The staff is set out in the memo. You may have that, Mayor, where they're ready to go, and they encourage them to bring there.
Switching to, with churches coming up, with obviously Easter this weekend, just to remind folks, what are you asking of churches this Sunday in terms of services for here in our city and county?
We're asking them to protect their congregations by not hosting in-person worship. The Archbishop and the Archdiocese have taken a really strong leadership role in this, have already planned their live streaming. Some of the largest congregations in this community are doing the same. Community Bible Church, Cornerstone, all hosting live streaming services. We're asking the faith community to recognize the vulnerability of their congregations and not, in this very dangerous period of infections, host those in-person meetings, which are, based on where we are with community spread, not following CDC guidelines.
I just can't imagine a pastor doing that and putting his congregation in jeopardy. Let's hope that doesn't happen over the weekend, but it is up to each church as designated by the governor.
If they do decide, I know you're saying you hopefully don't find one. If they do decide, would there be any punishment or anything like that? If they do decide to have a service this Sunday.
So they have to follow social distancing guidelines regardless. Every business, everyone has to follow social distancing guidelines. But, if you read the CDC protocols and the guidance on worship and religious services in a period where you have substantial community transmission, it says do not host in-person worship ceremonies, worship services. And so we think that that's important. There's some mixed messages coming from the state on this, but if you listen to the CDC guidance in terms of how to keep your congregation healthy and alive, you do not host in-person services right now during this very dangerous period of community transmission.
Mayor, Judge, and also in regards to the two facilities that have been selected for those southeast side nursing home patients, do we know how many rooms would be available if it is needed? That
southeast side is not moving. They're staying where they are.
Okay, we're just talking about regards to rooms. Is there going to be a number of rooms that would be available if they are going to be transported?
Are you talking about a nursing home?
Yes, the one over the Westover. We just wanted to know the number of available rooms over at the West Hills.
I think it's over 100.
Over 100.
Over 100. Thank you. And Mayor, you also had mentioned something about the Apex model last week. Do we know the status of that right now?
Yeah, so there's quite a few, and they vary, obviously, in terms of when we anticipate reaching our peak. But we're hoping within the next 24, 48 hours to have some locally based models. We're also going to be putting up some of the other models that are available from other universities and institutions on the website. But I am anticipating models being shown on the San Antonio San Antonio.gov/COVID-19 website by tomorrow.
Mayor and Judge, we had some questions texted in from reporters who couldn't make it tonight. From Spectrum, in addition to the face mask, are there changes being made at the jail to better ensure the health of inmates and county employees?
Well, first of all, when somebody does get to the jail, they get a health checkup on that right away to make sure they don't have any symptoms that might be leading to the COVID. That's done right away. We are checking constantly within the jail now to see if there's any symptoms. We're looking for symptoms, and then when they do leave, they're going to be checked again. So we've had those measures in place now for I guess at least 3 or 4 weeks. And now we're taking these additional steps, requiring everybody to wear a face mask, separating someone that may show symptoms, and the one that had the COVID, put them in an isolation cell. So I think we're doing just about everything we can. University Hospital is our health directors there in the jail. They're on it. So we're taking every step we can reasonably take to handle it.
Also from Spectrum, are you worried that other inmates may be infected but are asymptomatic?
Yes, we are.
A third question for Spectrum, when it comes to San Antonio's hospital bed capacity, how do we compare to other areas across the state, and are we well equipped to handle our growing population should a large outbreak occur?
Well, we're in good shape right now, and based on the infection rates in other cities, we're actually doing better than other cities in terms of the overall numbers of infections per our population. And considering where San Antonio is in terms of emergency preparedness capacity, we're in good shape. But as we have talked about over the last couple of weeks, we also have surge capacity plans underway right now, including the additional beds made available through Freeman Coliseum.
We're hanging still really good. We have 2,031 available beds in the hospital today, and we still have 541 ventilators, and those numbers have been pretty much the same for the last week or two.
From Tom Orsborn at the Express News, although the food bank managed to pull off yesterday's distribution that fed 10,000 households, it was a stressful situation late in the day due to a shortage of volunteers. Is there anything the city and county can do to help the food bank with these massive giveaways?
Well, first of all, there has to be a better intensity where the person can go to the store to get it. And I think the last number I heard, there's over 100,000 people on what we referred to as food stamps before. And I know unemployment benefits are starting to come in. So we need to have a system that does it in the stores rather than having somebody have to drive a car and sit for, 2.5, 3 or 4 hours waiting to be able to get in. We're going to need help with the federal government to make sure we get that implicated and they do get some kind of certificates if indeed they have need. The problem we have when that many people show up, who are the ones that are totally in desperate need of the food? And it's hard to separate those. So it's a very, very difficult way to handle that.
And the judge and I, along with Gordon Hartman and our city council and our commissioners court, are working on these very issues through the COVID-19 community action groups. We have a food and shelter group that's examining this and how to handle the loads that are coming in. But you do get a true sense of the scale of this crisis by looking at those photos. And we're not unique. This is not, every city in the country is struggling with food supply issues. But I can tell you that this is one of the critical issues that we're focusing on, and we will make sure that our families here in San Antonio don't go hungry.
It just seems to me, and I may be wrong, but it seems to me you're better off passing out a certificate. I don't know what the food is worth that they're giving away, but give somebody a certificate where they can go to the store and buy it. It seemed to me like that would stop a lot of the people having to stay there for hours and hours.
A question from Telemundo. Can you confirm that an employee of Village Nursing Facility tested positive for COVID-19?
Let me see. So we have I don't have Village on my list. I will tell you that there are 4 staff of the previously reported 3 staff at Kindred Hospital, that's downtown, that are isolated. We also have a home hospice group, which has 4 staff members who are isolated positive, but we don't have any place by the name of Village on the list.
Also from Telemundo, how is the city ensuring that workers are not working in more than one healthcare facility?
It's a directive, it's law, it's also guidance from the president, so we are enforcing that. If we have any violations, it will be enforced, but we're also trying to work with the providers. Again, this is a long-term care facility and nursing home facility order in our emergency declarations.
Are the 2 facilities, nursing homes, that are designated to take COVID-19 positive residents ready to take these patients?
Yes, they are, and we're going to be inspecting them over the weekend and to make sure that they're up to par. But when they told us they were going to make those facilities available, we expect them to be available. But hopefully, again, we won't need to use them.
Have any patients been sent as of now?
No.
No, and we don't have any to send.
From Darian Trotter, News 4, several area churches have let it be known they will hold Sunday service. How will the services be policed?
Well, I don't know what those churches are, but again, they would be they would be going against the health authorities' guidance at the national level and the local level. We have a dangerous period of community spread, and for the health and safety of the congregants, many of whom are older or vulnerable by nature of the diversity within those congregations, we advise them not to hold in person. But absolutely, even if they're outside, they have to be exhibiting social distancing, but they should not be holding in-person services for the health and safety of their congregants.
If they're determined to do it, the mayor mentioned it, you better to be outside where you can keep the social distance rather than bringing them to a facility where it could spread very quickly.
From Alejandra and Guzman Tracy with News 4 and Fox 29, even with the rental assistance program and money set aside, we spoke to a resident who says she's lost 100% of her business, and the agreement her complex gave her would be to defer payments, but they would be added at the end of next month's rent. If she can't pay the fee now, she won't be able to afford an even larger sum. What recommendations do you have for residents in her situation who fear getting evicted?
Well, we are stopped evictions, and all the courts are upholding that. Now, the issue becomes after that's over with. I don't have a clear answer to that yet, but during this crisis, we're not letting them evict.
And we do have council members and commissioners court members working on that issue right now, and we hope to have some options available legislatively to make sure that when this is all over, that not all of a sudden do we have folks being pushed out on the street. We got to all be in this together if we're going to get through this together.
From Randy Beamer of News 4 and Liz Ruiz of KTSA, what is your reaction to Governor Abbott's statement today about Bexar County possibly reaching its peak or apex? What kind of reaction could that mean for the community? Could residents get excited about being able to move about sooner?
I think you have to be cautious, extremely cautious. There's a lot of models out right now. I just mentioned the ones that we'll be putting all that data on our website. But even if we have reached peak right now, that means that we're not out of the woods. It would be very dangerous and reckless to let our guard down now. And we do have to go by Dr. Fauci, who is leading this nationwide effort, who said that this is not the time to let our guard down at all. And so I think the guidance is continue to follow the health authority, and let's make sure we continue to stay home and stop the spread, because it is now it's only beginning to rise in our city, and we've got to make sure we keep each other safe.
Hopefully we'll have a little better sense of where we are sometime next week, but we're still very consistently growing at about 50 more cases every week. If that number starts to come down, then I'd feel a lot more comfortable that he was correct.
From Josie Garcia with News 4, What would you say to people considering suspending social distancing for the Easter holiday so they can get together with their families?
Not a good idea. Get together with your families, maybe, but we're still recommending social distancing, no more than 10 in a room or something like that, isn't it? But you got to keep that social distance.
Yeah, I believe it was Chicago, it may be a different city, whose outbreak, which is now one of the hot spots in the country, was traced to one family gathering. If you're getting together with the people who are already living in your household, that's one thing. But if you start introducing folks from outside, even if they're family members, you've got to exhibit the social distancing. You've really got to stay home. This is very difficult, we know, but it can be short-lived if we work together to stop the spread, and that's what we're doing right now.
Here's how we're going to celebrate Easter. We're going to Zoom. My son's going to be the host of it, Matthew Wolf. And all of us are going to get on Zoom, and we're going to celebrate Easter together, but not going to jeopardize each other's lives.
Another question from Liz Ruiz of KTSA regarding Governor Abbott. He could be issuing an executive order next week concerning reopening some businesses. What are your thoughts?
Well, whatever happens, we're going to have to phase it in, and we'd have to see what his guidelines would be. The economy is just not going to all of a sudden cure itself, and there's going to have to be some steps. So we look forward to seeing what his guidelines are and seeing when he thinks they ought to be implemented. And I would think you'd implement them, once you start that downslide at some point.
From Jackie Wang with the Rivard Report, could you repeat the capacity of beds at the 2 nursing homes that are taking COVID-19 patients?
It's over 100 in each one, wasn't it?
Yeah, I believe it's around. Yeah, it's over 100 for sure at Westover Hills. We don't know the other one. I don't know the other one specifically, but again, this is empty rooms, empty beds that we hope we'll never have to use, because that would mean that we have more nursing home residents, our neighbors, the most vulnerable among us, who have turned up positive. But as of tonight, the only nursing home residents that we have confirmed positive cases of COVID-19 is Southeast Nursing and Rehabilitation Center, what we've been talking about for a couple of weeks, and those folks are staying. That cohort is staying at Southeast.
Also from Jackie Wang, is there any update on the Franklin Park nursing home resident who tested positive?
It's the only one that's positive. I know, wasn't that true?
That's right, yeah. We've had 7 come back negative, so we only have the 1 positive at Franklin.
Thank you.
Okay.
Thanks, y'all. Happy Easter.